Welcome to this training section on infant CPR and relief of choking. In this training, we will cover essential life-saving techniques that can help you respond effectively in emergency situations involving infants. As caregivers, parents, or individuals responsible for the well-being of infants, it is crucial to be prepared and equipped with the knowledge and skills to provide immediate assistance in critical moments. Infants have unique needs and require special care when it comes to CPR and relieving choking. By learning these skills, you will be prepared to respond effectively in emergency situations involving infants. An infant is anyone under the age of 12 months old. In this training, we will focus on two key topics: infant CPR, cardiopulmonary resuscitation, and relief of choking. These skills can make a significant difference when an infant's life is at stake. Let's begin with infant CPR. In this section of training, we will discuss how to perform CPR on infants, which is an essential life-saving skill. Performing CPR on an infant is different from performing CPR on adults or older children due to their unique anatomy and size. By learning and practicing infant CPR, you can be prepared to respond effectively in an emergency situation. The first step to infant CPR is to check for responsiveness. Gently tap the infant's shoulder and shout, "Are you okay?" If the infant does not respond and is not breathing or only gasping, this indicates a medical emergency. After determining they are unresponsive, call for emergency services. If you are alone, perform CPR for about 2 minutes before leaving to call for help. If someone else is available, ask them to call emergency services immediately. Now that help is on the way, position the infant. Carefully place the infant on a firm surface, such as a table or the floor. Ensure that the surface is stable and secure. Next, we will open the airway. Place one hand on the infant's forehead and 2 fingers on their chin. Gently tilt the head back to lift the chin and open the airway. After the airway is open, check for breathing. Begin by looking, listening, and feeling for breath. Watch for chest rise, listen for breath sounds, and feel for any air movement on your ear for no more than 10 seconds. If the infant is not breathing or only gasping, it is an indication to begin CPR. It's time to perform chest compressions. To start chest compressions, place 2 fingers on the center of the infant's chest, just below the nipple line. Using your fingers, deliver gentle but firm compressions, about 1.5 inches deep. Perform 30 chest compressions at a rate of about 100 to 120 compressions per minute. Let the chest rise fully between each compression. The next step is provide rescue breaths. Cover the infant's mouth and nose with your mouth, creating a seal. Give 2 gentle breaths, each lasting about 1 second. Watch for chest rise with each breath. Be careful not to overinflate their lungs. Continue cycles of compressions and breaths. Perform cycles of 30 compressions and 2 breaths until help arrives or until the infant shows signs of life. Let's review the steps. Check for responsiveness. Tap them and ask, "Are you okay?" Call for help or have someone call for you. Hey, go call 911. Position on a firm surface. Open their airway. Check for breathing using the look, listen, feel method. If they're not breathing, start CPR with 30 chest compressions with 2 fingers. Provide rescue breaths, covering their mouth and nose with your mouth, being careful not to overinflate their lungs. Continue the cycles of 30 compressions and 2 rescue breaths until help arrives. That's all the steps to follow to provide CPR to an infant.